In this session, we will discuss about muscles of scapular region, intermuscular spaces and axillary nerve. For that, I am taking scapula here. This is scapula. This is superior angle of scapula and this is superior border of scapula and this is suprascapular notch. This is coracoid process and below that we can find one fossa. What is this fossa? Glenoid fossa. And this is lateral border of scapula. Of course, this is inferior angle of scapula. Is it? So, this is scapula, right? Then, since we are seeing the posterior aspect of the scapula, here we can find spine. What is the spine? Spine of scapula. So, this is spine of scapula. Spine of scapula, in the lateral part, it becomes the acromion process. Is it? So, this is acromion process. Then, what is this cavity? Glenoid cavity. Glenoid cavity articulated with what? Head of the humerus. So, here I am drawing head of the humerus. The joint between the glenoid cavity and head of the humerus. What is that joint? Shoulder joint. So, this is head of the humerus. And this is greater tuberosity of humerus. And this is shaft of the humerus. So, here this is surgical neck at this part and this is shaft of the humerus. And in the lower part, shaft shows medial and lateral supracondylar ridges. After that, this is medial epicondyle and this is lateral epicondyle. Since we are drawing posterior aspect of the humerus, here you can see one fossa. What is this fossa? Olecranon fossa. This is olecranon fossa. Olecranon fossa gives accommodation to the olecranon process of ulna. So here I am drawing olecranon process. So this is olecranon process of ulna. This is ulna. This is olecranon process of ulna and this is shaft of ulna. And laterally, this is the head of the radius. This is head of the radius and this is the radial tuberosity and this is shaft of radius. With this bony landmarks, we will discuss about muscles of scapular region. Here, you can show supraspinatus muscle, infraspinatus muscle, teres minor muscle, teres major muscle. But if you wanted to discuss about subscapularis muscle, we have to take the ventral aspect of scapula, right? So, here I am drawing ventral aspect of scapula. So, I am turning the scapula this side so that this is coracoid process and this is suprascapular notch. This is superior border. This is superior angle. This one, this is superior angle and this is medial border and here you can see glenoid cavity and this is lateral border of scapula and this is inferior angle of scapula. Is it? This is ventral aspect of scapula. This is dorsal aspect of scapula. This is dorsal aspect of humerus. Here I am going to draw ventral aspect of humerus because ventral aspect of humerus having lesser tuberosity because subscapularis muscle inserting to the lesser tuberosity. So, this is glenoid cavity and this is head of the humerus. This is head of the humerus. This is greater tuberosity. This is shaft of the humerus. If it is greater tuberosity, here you can find one more tuberosity. What is this tuberosity? Lesser tuberosity. So, this is lesser tuberosity, this is greater tuberosity. In between these two, you can find one sulcus. This sulcus what we are calling intertubercular sulcus. Intertubercular sulcus having lateral lip and also medial lip. So, this is medial lip and this is lateral lip. So, here I am drawing medial lip and lateral lip. With this bony landmarks, we will discuss about supraspinatus, infraspinatus, subscapularis, teres minor, teres major. First we will take supraspinatus muscle. Supraspinatus muscle taking origin from the medial 2/3 of supraspinous fossa. See here, this is the dorsal aspect of the scapula. It is having spinous process. The spinous process divides the dorsal aspect of the scapula into upper part and lower part. This upper part what you are calling supraspinous fossa. Lower part what you are calling infraspinous fossa, right? So, from the medial 2/3 of supraspinous fossa giving origin to the supraspinatus muscle. So, this is supraspinatus muscle. This supraspinatus muscle becomes tendon and it passes deep to the arch which is present in between the coracoid process and acromion process. What is that arch? coracoacromial arch or secondary socket for the shoulder joint. So this is the tendon of supraspinatus muscle. It passes deep to the coracoacromial arch, right? Then it reaches to the, what is this tuberosity? Greater tuberosity. Greater tuberosity having superiorly one impression, in the middle impression, in the lower part lower impression. There will be 3 impressions, right? So supraspinatus muscle inserting to the upper impression of greater tuberosity of the humerus. So this is the insertion. This muscle is supraspinatus muscle. Then if you take the infraspinatus muscle, it is taking origin from the medial 2/3 of infraspinous fossa. So this is the origin of it, right? Then from here it is taking origin. Then it is also going laterally to where? To insert over the middle impression of greater tuberosity. So origin is medial 2/3 of infraspinous fossa. Then insertion is middle impression of greater tuberosity. So this is the infraspinatus muscle. Then teres minor. Actually we have to discuss about subscapularis muscle. Let me finish teres minor and major, then we will go to that side. Teres minor muscle taking origin from the upper 2/3 of dorsal aspect of lateral border of scapula. So upper 2/3 means what? From here to here. This is dorsal surface and lateral border. Dorsal surface of lateral border of scapula. Upper 2/3 of dorsal aspect of lateral border of scapula. So this is the origin of teres minor. From here it has to go and insert it to where? Lower impression of greater tuberosity of the humerus. So like this it will go and insert. So this muscle is teres minor. This is infraspinatus and this is teres minor, right? Then teres major muscle taking origin from lower 1/3 of dorsal aspect of lateral border of scapula, right? So from here it is taking origin. Along with lateral border it is taking origin from the inferior angle also. So lower 1/3 of dorsal aspect of lateral border of scapula and also inferior angle, right? From this area it is taking origin, and where it has to insert? It is teres major muscle. Is it? Teres major muscle inserting to where? What is this lip? Medial lip of intertubercular sulcus. Lateral lip is giving insertion to the pectoralis major and medial lip is giving insertion to the teres major. So this is teres major. This is teres minor muscle and this is teres major muscle. Then subscapularis muscle. Subscapularis muscle taking origin from medial 2/3 of subscapular fossa. Actually this is ventral aspect or anterior surface of scapula. Anterior surface of scapula we can also call as costal surface of scapula. Subscapularis muscle taking origin from medial 2/3 of subscapular fossa. From here it is taking origin. Then where it has to insert? It will be inserting to the this tuberosity. What is this tuberosity? Lesser tuberosity, like this. So this is about the subscapularis muscle. Then what are the actions and nerve supply of these muscles? Supraspinatus muscle is initiator of abduction. That means first 15 degrees of abduction done by supraspinatus muscle. Of course it is a little controversial, even though remember that it is initiator of abduction. That means first 15 degrees of abduction done by supraspinatus muscle. Along with that, supraspinatus muscle is one of the rotator cuff muscle. What is rotator cuff? Rotator cuff we can also call as musculotendinous cuff. This musculotendinous cuff is formed by 4 muscles: supraspinatus, infraspinatus, teres minor and subscapularis. That means imagine this is the humerus. Humerus will be having the lesser tuberosity and greater tuberosity. Anteriorly lesser tuberosity giving insertion to the subscapularis. Then above supraspinatus, then infraspinatus, then teres minor. All these 4 muscles holds the humerus like this. Imagine this is subscapularis muscle, this is supraspinatus, this is infraspinatus and this is teres minor. All these 4 muscles They insert it to the lesser tuberosity and greater tuberosity of the humerus. When they are inserting, they becomes the fibrous tissue, and those tendons, that means the fibrous tendons, will blends with the capsule of shoulder joint, so that these muscles will strengthen the shoulder joint. But inferior part, there is no such arrangement. Because of that, inferior dislocations of shoulder joint is common. Very simple. Rotator cuff muscles are 4. Subscapularis inserting to the lesser tuberosity. Supraspinatus inserting to the upper impression of greater tuberosity. Infraspinatus inserting to the middle impression of greater tuberosity. Teres minor inserting to the lower impression of greater tuberosity. When these muscles are inserting, they becomes flattened tendon or they becomes the fibrous tissue, and they blends with the capsule of shoulder joint and give strength to the shoulder joint when movements occur in the shoulder joint. Those muscles what we are calling rotator cuff muscles. So when they are inserting, we cannot show those are separate muscles. When they are inserting, they fuses with one another and they fuses with the capsule also, right? These muscles will be fuses with one another and fuses with the capsule and strengthens the shoulder joint. So these muscles what we are calling rotator cuff muscles. Then here we have to tell about the action of supraspinatus muscle. Action of supraspinatus muscle is initiation of abduction, that means first 15 degrees. Because of that, if there is any injury or any inflammation of this supraspinatus muscle, initial 15 degrees of abduction will be not possible. Because of that, when we ask the patient to abduct the limb, when there is inflammation or injury to the supraspinatus tendon, he will lean sidewards so that 15 degrees of abduction will come. From here, he will abduct with the help of deltoid muscle. So, initiation of abduction by supraspinatus muscle. Then, what is the nerve supply of it? Suprascapular nerve. Of course, it is a branch from the upper trunk of brachial plexus at the level of Ebb's point. Then we can say one more applied aspect, supraspinatus tendinitis. Inflammation of tendon of supraspinatus, which leads to painful arc syndrome. Actually, we have to tell one more thing related to it. In between the coracoacromial arch and the tendon of supraspinatus, there will be bursa. That bursa what we are calling subacromial bursa. What is it? Subacromial bursa. Whether the inflammation of this bursa or inflammation of tendon or tearing of tendon, which leads to painful arc syndrome. What does it mean? In between the 60 to 120 degrees of abduction, patient feels pain. Why? Up to the 60 degrees, there is no impingement between the greater tuberosity of the humerus and the coracoacromial arch. If there is inflammation, there will be impingement of this bursa and also tendon, which leads to pain. So, up to the 60 degrees, there is no impingement. Impingement will start at the 60 degrees, then ends at the 120 degrees. So, that syndrome what we are calling painful arc syndrome. Usually, supraspinatus tendon will undergo degeneration and which leads to calcification. Sometimes it leads to tear also. Then, one more applied aspects related to it, subacromial bursitis. I told you there is a bursa here. That bursa inflammation, what we are calling subacromial bursitis, right? In case of subacromial bursitis, if you wanted to check whether subacromial bursitis or not, you have to press or you have to compress over the upper part of the deltoid muscle when the arm is on the side. When you compress here, patient feels pain. And if you compress at the same point when patient abduct, that time this subacromial bursa will be pushed medially so that patient will not feel pain. That sign what we are calling Dabarn sign. Dabarn. D-A-W-B-A-R-N apostrophe S. Dabarn sign. Right? Very simple. We have to ask the patient to keep the upper limb or keep the arm by side of the body. Then we have to compress over the upper part of the deltoid muscle. If he feels pain, there is inflammation of subacromial bursa. Then at the same point you have to compress, but that time you have to ask the patient to abduct. When patient abduct, bursa will be pushing medially. If you compress over it, patient will not feel pain. Right? That sign what you are calling Dabarn sign. That is about the supraspinatus muscle. Then what is this muscle? This is infraspinatus. I think these muscles are not demarcated properly. That's what I will draw these muscles boundaries with different color. So this is infraspinatus muscle. This is infraspinatus muscle, and this is supraspinatus muscle. This is teres minor. This is teres minor. This is teres major. This is subscapularis muscle. What is the action of infraspinatus muscle? Infraspinatus muscle is lateral rotator of shoulder joint. You remember that. That is sufficient. Then what is the nerve supply? Suprascapular nerve only. After that, what is this muscle? Teres minor muscle. Teres minor muscle also lateral rotator of shoulder joint. Of course, these muscles are forming the rotator cuff, right? Then what is the nerve supply of teres minor muscle? Teres minor muscle supplied by posterior division of axillary nerve. Otherwise, simply remember axillary nerve. Then what is this muscle? Teres major muscle. What is the action of teres major muscle? Adduction and medial rotation. Adduction and medial rotation by teres major muscle. Then what is the nerve supply of teres major muscle? Lower subscapular nerve. Subscapularis muscle supplied by both upper and lower subscapular nerves. But lower subscapular nerve not only supplying to the subscapularis muscle, it is also supplying to the teres major muscle. Clear? Then what is the action of subscapularis muscle? Same as teres major, it is adductor and medial rotator of shoulder joint. These are the different muscles. Now we have to discuss about intermuscular spaces. For that, we need to draw one more muscle. That muscle is triceps muscle. Even though it is not a muscle of scapular region, since it is forming the boundaries for the intermuscular spaces, here I will discuss about the triceps muscle. Triceps name implies that it is having three heads: long head, medial head and lateral head. Before that, let me draw one groove here. What is this groove? This groove is spiral groove. This groove is spiral groove. Spiral groove having medial lip and lateral lip. This is medial lip and this is lateral lip. Long head taking origin from this tubercle. What is this tubercle? Here there is a tubercle. This tubercle what we are calling infraglenoid tubercle. So it is taking origin from the infraglenoid tubercle. From here it is taking origin. That means from here. This is the long head of triceps. So here I am drawing long head of triceps. But this long head of triceps I am drawing deep to the teres minor. Is it? So teres minor is present behind the long head of triceps. That's what I am drawing like this. So this is long head of triceps. But it is passing behind the teres major. That's what I am drawing continuous line here. So this is long head of triceps. Then remaining two heads are there. What are these two heads? Medial head and lateral head. Lateral head taking origin from the lateral lip of spiral groove. Lateral lip of spiral groove. Then medial head taking origin from medial lip of spiral groove and also area below the medial lip of spiral groove. That means this total posterior surface below the medial lip of spiral groove. This area giving origin to the medial head of triceps. So this is medial head, right? Actually not only this bony part, here you can found intermuscular septa. What is this intermuscular septa? Medially medial intermuscular septa, laterally lateral intermuscular septa. So this medial head taking origin from medial lip of intertubercular sulcus and area below the medial lip of intertubercular sulcus, medial and lateral intermuscular septum also, right? So from here it is taking origin, from all these places it is taking origin like this. After that, where it has to insert? It will be inserting to this process. What is this process? Olecranon process. So the tendon of triceps inserting to the olecranon process. So this is triceps muscle. If you draw same structure here also, this is long head of triceps. And we know that this is teres minor. This is teres minor and this teres minor will be going back. Because of that I cannot show you insertion. And what is this muscle here? This is teres major. This is how anterior view will be present. Actually, if you wanted to see all these insertions of scapular region muscles, you have to reflect the deltoid muscle. Then only you can see. That's what here I am drawing reflected part of deltoid muscle. This is reflected part of deltoid muscle. So these are the cut sections of muscle fibers and these are the muscle fibers. So what is this muscle? This is deltoid muscle. If I draw this side also, this is deltoid muscle. These are the muscles which are present in the scapular region, and we have discussed about triceps muscle also. This is helpful when you are discussing about the intermuscular spaces. I hope you understood the muscles of scapular region. After break, we will discuss about intermuscular spaces. Now we will discuss about intermuscular spaces. See here, you can see one space here. This is quadrangular space. This is one space. This space is upper triangular space and this is lower triangular space. To remember that, you keep the two fingers like this. Imagine this finger is teres minor, this finger is teres major, and remember this finger, this one is long head of triceps and this finger is humerus. So you keep these fingers like this. We are seeing these structures from the posterior view. You have to keep like this, right? So this is teres minor, this is teres major, this is long head of triceps and this is humerus. If we keep like this, here one space is there in the upper part, that is quadrangular in shape. That's what it is, quadrangular space. And in the upper part here, one triangle is there, that is upper triangular space. Here one more space is there, that is lower triangular space. If you remember this, discussing about boundaries of intermuscular spaces is very easy. If you take the quadrangular space, superiorly by teres minor, inferiorly by teres major, medially by long head of triceps, laterally by surgical neck of humerus. Then if you take the upper triangular space, superiorly by teres minor, inferiorly by teres major, laterally by long head of triceps. Then if you see lower triangular space, superiorly by teres major, medially by long head of triceps, laterally by medial border of humerus. That means laterally by humerus. These structures we will compare here. We will keep like this. Is it? Now this is quadrangular space. This is upper triangular space. This is lower triangular space. So this quadrangular space bounded superiorly by teres minor. Actually, along with teres minor, this muscle also will form the upper boundary. What is this muscle? Subscapularis muscle. And also here joint is there. What is this joint? Shoulder joint. So for superior boundary of quadrangular space, we have to remember two more structures along with teres minor. What are those? Subscapularis and capsule of shoulder joint. Subscapularis and capsule of shoulder joint. Superiorly. Inferiorly teres major. Medially long head of triceps. Laterally surgical neck of humerus. Then what are the contents which are present in it? See here. This is axillary nerve. Posterior circumflex humeral vessels. That means this is posterior circumflex humeral artery and this is posterior circumflex humeral vein. These are the structures which are passing through the quadrangular space or contents of quadrangular space. Very simple. Superior boundary is formed by teres minor, subscapularis and capsule of shoulder joint. Inferiorly by teres major, medially by long head of triceps, laterally by surgical neck of humerus. Contents: axillary nerve, posterior circumflex humeral vessels. Then what is this space? Upper triangular space. Boundaries: superiorly by teres minor, inferiorly by teres major, laterally by long head of triceps. Then what are the contents? Circumflex scapular artery. Actually, circumflex scapular artery is branch from the subscapular artery. This branch winds around the lateral border of scapula and enters into the infraspinous fossa to complete the anastomosis around the scapula. That means it is giving contribution for the anastomosis around the scapula. Right? Along with that, you can draw vein also. Circumflex scapular vein. So these are the boundaries and contents of upper triangular space. Very simple. Superiorly by teres minor, inferiorly by teres major, laterally by long head of triceps. Contents: circumflex scapular vessels. Then what is this triangle? Lower triangular space. Bounded medially by long head of triceps, laterally by medial border of humerus superiorly by teres major. Very simple. Superiorly by teres major, medially by long head of triceps, laterally by medial border of humerus. Then what are the contents? Radial nerve. This is radial nerve. Actually, from this triangle only, radial nerve enters into the spiral groove. So this is radial nerve. Then blood vessels also present. What are those? Profunda brachii vessels. This is profunda brachii artery and this is profunda brachii vein. Profunda brachii artery and profunda brachii vein. So these are the contents which are present in the lower triangular space. Once again, medially long head of triceps, laterally medial border of humerus, superiorly by teres major. Contents radial nerve and profunda brachii vessels. This is about the intermuscular spaces. Now we will discuss about the axillary nerve. Axillary nerve is branched from the posterior cord of brachial plexus. Root value is C5 and C6. C5 and C6. Root value is C5 C6. Branch from the posterior cord of brachial plexus. It is present in the lower part of axilla, behind the axillary artery and in front of the subscapularis muscle. So here I am drawing axillary artery. See, this is axillary artery. This is axillary artery. Behind the axillary artery, there will be posterior cord of brachial plexus. So here I am drawing posterior cord of brachial plexus with dotted lines. Why? It is present behind the axillary artery. This posterior cord of brachial plexus is giving branch. That branch will be supplying to the deltoid muscle. Remaining 4 branches are there. This is also one of the branch of posterior cord of brachial plexus. So this nerve runs behind the axillary artery. So let me extend this axillary artery little below. This is axillary artery. In the lower part of axilla, posterior cord of brachial plexus is giving branch. What is that branch? Axillary nerve. So in the axilla, if you say the relations of axillary nerve, anteriorly axillary artery, posteriorly subscapularis, laterally muscle. Which muscle is this? It is coming from here. Coracobrachialis muscle. What is it? Coracobrachialis muscle. These are the relations of axillary nerve in the axilla. Anteriorly axillary artery, posteriorly subscapularis, laterally coracobrachialis. Right? Then from here, axillary nerve has to leave the axilla and it has to come backwards. That means it has to come posterior aspect. Because of that, this nerve, that means axillary nerve, winds around the inferior border of what is this muscle? Subscapularis muscle. It winds around the inferior border of subscapularis muscle and enters into this space. What is this space? Quadrangular space. When it is winding around the lower border of subscapularis muscle, it is in relation with the capsule of shoulder joint. See here, this is capsule of shoulder joint. Let me draw. This is capsule of shoulder joint. It is in intimate relationship with the capsule of shoulder joint, and there itself it gives branch to the shoulder joint. So it is giving branch to the shoulder joint. After that, it enters into quadrangular space. Up to here only I can show axillary nerve here. After passing through the quadrangular space, it comes back. So here I am showing the axillary nerve. This is axillary nerve. Within the quadrangular space, it divides into 2 branches, anterior division and posterior division. This is posterior division and this is anterior division. These divisions are in relation with the deltoid muscle. This anterior division winds around the surgical neck of humerus. After winding around the surgical neck of humerus, it runs anteriorly almost up to the anterior border of deltoid muscle, and it will be supplying to the deltoid muscle. Along with supplying to the deltoid muscle, it will also supply to the skin over the anterior-inferior part of the deltoid muscle. Right? Very simple. Anterior division of axillary nerve winds around the surgical neck of humerus and reaches to the anterior border of the deltoid muscle, that too underneath the deltoid muscle. Right? There it will be supplying to deltoid muscle and also skin over the anterior-inferior part of the deltoid muscle. That is about the anterior division. Then posterior division. See, this is the posterior division. Posterior division will give branch to this muscle. What is this muscle? Teres minor. Branch to the teres minor, and branch to the deltoid. That means branch to the posterior part of the deltoid. This is branch to the teres minor muscle. Branch to the teres minor muscle shows one dilatation here. See here, I am drawing dilatation. This dilatation, what we are calling pseudoganglion. Since it doesn't have any cell bodies of neurons, it is pseudoganglion. If you have cell bodies of neurons, that arrangement is ganglion. But here, it doesn't have any cell bodies. It is made up of fibrofatty tissue. That's what this dilatation, what we are calling pseudoganglion. So, posterior division of axillary nerve will give branch to the teres minor muscle. That branch will supply to the teres minor after formation of pseudoganglion, right? That is about branch to the teres minor. Then branch to the posterior part of the deltoid muscle will supply to the posterior part of deltoid muscle. Then this continuation of posterior division piercing the deep fascia. It is piercing the deep fascia at the posterior inferior part of the deltoid muscle and becomes cutaneous. Continues as upper lateral cutaneous nerve of arm. What is it? Upper lateral cutaneous nerve of arm. Here it is piercing the deep fascia. It is piercing the deep fascia and becoming upper lateral cutaneous nerve of arm. Recollect once again. Axillary nerve is branched from the posterior cord of brachial plexus. Root value C5, C6. It is present in the lower part of axilla, behind the axillary artery and in front of subscapularis muscle. That means relations of axillary nerve. Anteriorly axillary artery, posteriorly subscapularis muscle. Laterally coracobrachialis. These are the relations in the axilla. Now this nerve leaving the axilla by winding around the inferior border of subscapularis muscle, where it is intimately related with the capsule of shoulder joint. So there it gives branch to the capsule of shoulder joint. After that it enters into quadrangular space and leaves the axilla and appears in the posterior aspect. From here it enters into the quadrangular space and appears in the posterior aspect. In the posterior aspect, within the quadrangular space, it divides into anterior division and posterior division. Anterior division winds around the surgical neck of humerus along with posterior circumflex humeral vessels. Then it reaches almost to the anterior border of deltoid muscle, where it supplies to the deltoid muscle and also supplies to the anterior inferior part of skin over the deltoid muscle. Then posterior division. Posterior division gives branch to the teres minor and also posterior part of deltoid muscle. The branch to the teres minor will have one pseudoganglion or it bears one pseudoganglion. This pseudoganglion made up of fibrofatty tissue, doesn't have any cell bodies of neurons. It gives branch to the posterior part of deltoid muscle. Then continuation of posterior division at the posterior inferior margin of the deltoid muscle, it pierces the deep fascia and becomes cutaneous and continues as upper lateral cutaneous nerve of arm, right? So this is the course relations. If you wanted to say the relations in the quadrangular space, you can say the boundaries of quadrangular space only. Superiorly by teres minor, capsule of shoulder joint, subscapularis. Inferiorly by teres major. Medially by long head of triceps. Laterally by surgical neck of humerus. These are the relations of axillary nerve within the quadrangular space. Then what are the applied aspects? Usually axillary nerve will be injured due to improper usage of crutch. Actually, when the lower limbs are affected, people used to walk with crutches. They keep the crutches in the axilla and they walk. At that time, there will be compression between the wood or metal which is present in the axilla and the humerus. In between these two structures, there will be axillary nerve. So, there will be compression. This is one cause. And intramuscular injections. Usually, you have to give intramuscular injection at the middle or lower part of the deltoid muscle. If you give injection at the upper part of the deltoid muscle, which may pierce the axillary nerve, which may leads to damage to the axillary nerve. That is one cause. Then fracture of surgical neck of humerus. Fracture of surgical neck of humerus also may damage the axillary nerve. Then one more reason is inferior dislocations of shoulder joint. These are the reasons for the injury to the axillary nerve. If there is injury to the axillary nerve, what will happen? It is mainly supplying to where? Deltoid muscle. So deltoid muscle will be paralyzed. If the deltoid muscle is paralyzed, there is no abduction up to 90 degrees. Along with that, this deltoid muscle will undergo atrophy, so that greater tuberosity can be prominently visible. Then skin over the deltoid muscle, especially regimental badge area. Actually, this area what we are calling regimental badge area. Usually army people will keep badge over here. That badge what we are calling regimental badge. Over that area, loss of sensation. Along with that, there will be paralysis of teres minor also. So these are the clinical features when the axillary nerve is injured. So this is about muscles of scapular region, intermuscular spaces, axillary nerve. That's it for this session.